Good morning, everyone. I want to thank you for joining this webinar on the status of women and girls in Minnesota. My name is Gloria Perez, and I'm the president and CEO of the Women's Foundation of Minnesota. And I'm so excited to be with you here today, joined by two leading researchers who I will introduce shortly. I would like for them to share their insights on the report and what it means to the lives of women and girls in the state. This report represents leading research on the status of women and girls in Minnesota. At the Women's Foundation, we've been investing in research since our inception. Since 2009, we have partnered with the Center on Women, Gender, and Public Policy here at the Humphrey School to produce this report, which investigates how women and girls are faring in the areas of economics, health, safety, and leadership. This research is inclusive of gender expansive and trans women, representing the full experience of how we define women at the Foundation. As we talk today, we'll share data about how women and girls in the state face added barriers and sometimes opportunities based on the identities they hold. We are interested to hear from you. So to facilitate the presentation, the chat will be disabled, but I invite you to use the question and answer button at the bottom of your screen to submit questions at any time. We'll look for your questions and address them as time allows. This report holds so much more than we're able to discuss today. I hope this presentation offers a chance to learn more about what the experience is really like for women and girls across our state through the areas that we dive into today. This presentation is one of a series of big and small convenings for our Road to Transformation, formerly known as our Road to Equity Tour. Our Road to Transformation will take this data in research, bring it directly to communities to hear how it resonates with the experiences of community folks, to hear what stands out to them, and to hear their ideas for solutions. So as I said, we're joined today by Dr. Christina Ewig, the lead researcher on this report and faculty director on the Center of Women, Gender, and Public Policy at the University of Minnesota. Dr. Brittany Lewis is also joining us in this conversation today, and we want her to share her perspective on research and how she puts it to work in community to create solutions. Last year, the Women's Foundation partnered with Dr. Lewis on the Trust Black Women and Girls Town Hall to listen directly to Black women and girls as they share their lived experience around key issues such as housing, education, criminal justice, and health and wellness. She and others have really helped the state and city officials think about how to affect change at the state and local level. Amid this pandemic and the global uprising against racial injustice, we're acutely aware of how a crisis can exacerbate the inequities that have already existed at the root of our systems. We believe that there is power in uncovering the truth in our times. We are in a time of transformation. We are choosing to focus on the actions we can take and the changes we can activate at the systems level and through policies that consider the complexities of women's lives and the lives of girls. Audre Lorde said, "There is no single issue struggle because we do not live single issue lives." When we look at this data, we can feel dispirited by the inequities facing women and girls across our state. However, we can also identify the incredible wisdom and leadership being exercised by women and girls in their communities, despite experiencing the impacts of systems that push them to the margins in economics, health, safety, and leadership. Through the full report, we see something the research has long shown us, that the identities women and girls hold, from their gender to race, to the place where they live, to other realities that are part of their lived experience, greatly impacts their physical and mental health and the safety and access to economic opportunity and leadership. So we come to this work from various perspectives, but we are united in this work by valuing, trusting, and investing in girls together. We're launching this report at a time when we have seen struggle as a city, a state, and certainly as a country as we face this legacy of racial injustice and the way in which our experiences as Minnesotans are far from equal. At times, and in the eyes of this research, it seems like there are really two Minnesotas. One in which we're highly ranked in the measures of economic opportunity and quality of life. And yet we can see that Minnesota's Black, Indigenous, and people of color experience a state that has some of the worst racial inequities in the nation in terms of income, home ownership, and wealth. As we talk about the report today, we'll discuss some of the positive actions we can enact as individuals, institutions, and systems and policy levers to improve some of the disparities that women and girls, particularly Black, Indigenous, and women of color, are experiencing in our state. We'll also see how other identities, including older women, LGBTQ plus people, experience inequities that compromise their health, safety, and access to economic and leadership opportunities. As a state community foundation that invests in women and girls, we believe deeply in the power of community solutions to end racial and gender injustice. Our work is dedicated to transforming our state's systems to create a Minnesota where all women and girls can thrive. And I know Brittany and Christina, you're both invested in this work. So Dr. Lewis and Dr. Ewood, could you tell us a little bit about what brings you to this work? Let's start with you, Dr. Lewis.
Thank you so much, Gloria, for the overview and introduction. I'm a community engaged action researcher and thought leader in my community, and I really believe that we must fundamentally believe that the communities that we work with are the experts of their realities. This is particularly important, I think, for low-wealth Black women and women of color, more broadly speaking, I think, whose knowledge of the social, political, and economic world is often deemed unimportant or irrelevant. You know, popular media and elected officials regularly shame and blame low-wealth Black mothers and their families for their experiences with poverty. I believe community engaged action research should value community knowledge and people's lived experiences because I believe they have the answers or the solutions if we listen. The model that I work under and support reflects meaningful collaboration between academics, advocates, policymakers, service providers, and impacted communities. And additionally, it leads to more robust and holistic data, I think more effective policy solutions and stronger community action. I think when we use community engaged research as an ethics and a model, community members are not subjects of research, but they're really co-producers of knowledge. That's really the ethical grounding that bring me to my work. I'm born and raised in the Twin Cities from the North Side. I believe deeply in the community from which I'm from. And I also believe about kind of being a part of the solutions that we seek.
Thank you. How about you, Dr. Ewood?
Well, I come to this work similar in the ways that Dr. Lewis does as the director of the Center on Women, Gender, and Public Policy at the Humphrey School of Public Affairs. Our mission is to first understand gender inequalities, but also show and demonstrate to students, to researchers, to the general public, how public policy can impact those inequalities. And being from the Humphrey School, within the Humphrey School, really the ethos of the center is about community engagement. And so part of, we do research, teaching, outreach, a number of different things through the center, but when we do research, community engaged research is what we want to be doing. And that's why we've partnered with the Women's Foundation now for almost a decade in this research that focuses on disparities in Minnesota and thinking about Minnesotans from all walks of life with multiple kinds of backgrounds and experiences, and looking carefully at what those intersecting kinds of inequalities that they may experience impact the gender inequities that they also experience.
Thank you. For those who are unfamiliar with the Women's Foundation of Minnesota, we are the first statewide women's foundation in the country. We were founded in 1983 by a diverse group of activists, philanthropists, and community organizers representing a variety of identities and experiences living across our state. This was in 1983. They were concerned at that time that less than 3% of philanthropic dollars statewide were going to serve the needs of girls and women. 37 years later, we know that the percentage is actually not much better. And in fact, 0.5% of funds go to women and girls of color. So today, the Women's Foundation of Minnesota makes $3 million in community investments annually. 60% of our grantee partners are led by women of color, and 80% of grant making goes to programs working with and for women and girls of color across Minnesota. In addition to funding nonprofit partners that provide critical services and support to women and girls, the foundation is investing in systems change. From the beginning, we knew that we must invest in research like the one we're talking about today, and investing in developing policy that transforms systems and enables women and girls to reach their full potential. We know, and it's been in the news, that while Minnesota is #1 in a lot of things, like education and economic opportunity, that is not true for every Minnesotan. And we have this graph, this intersectional equity framework that we use in our work, in our programming and design and evaluation of grants. We know that women and girls' experiences with education, healthcare, employment, and wages are impacted by her gender, race, place in the state, or additional identities. And when we disaggregate the data, as we do in this report, we see how multiple identities held by women and girls have lifelong consequences that impact her health, safety, and economic security, literally life and death issues. Using the term coined by the lawyer and scholar Kimberly Crenshaw, the Women's Foundation developed this intersectional equity framework to illustrate how intersecting identities of individuals and communities impact their systemic access to opportunity, well-being, and equity. Through our work, we see the power and vision and value in individuals and communities most pushed to the margins. Their lived experiences with systems make them experts in identifying the community-specific solutions. They know best what they need. Solutions live in their communities, and the more we value and invest in their leadership, the better those solutions will be. So Dr. Lewis, when you participated as chair of the Trust Black Women and Girls Town Hall, was there anything that struck you in the testimony by women and girls speaking to their lived experiences across systems?
Yes, that was a powerful event, a year-long process that really aimed to amplify kind of the daunting realities that Black women renters, homeowners, mothers, caregivers, educators, and healers are experiencing in Minnesota. And I think most importantly about that event, it was Black women in themselves coming to develop solutions to those realities. And they were positioned in front of commissioners. And in the context of this event, commissioners were folks within a relative position of power across state or county agencies to actually influence that work. And I recall one quote that a particular testifier stated, and I wanted to share it with you all. This testifier stated, "Seeking housing was unaffordable, let alone trying to maintain housing from landlords that will nickel and dime you every chance they can get. I now live in a house that I have rented since 2009 with my mother and my kids, but at what cost? $2,025 a month. How much does your right to live a stable, affordable life cost? I just have had this feeling lately that I'm experiencing what it means to be renting while Black." So the testimonies that were featured during the town hall on 4 different issue area panels, as Gloria mentioned, housing, criminal justice, education, and housing, really illustrated how the lives of low-wealth Black women and their families are being mediated by systems that deny them humanity and often wield more power over the quote-unquote choices made available to them. These were some really, really powerful testimonies. We cried, we laughed, we kind of held space for one another. We talked about postpartum depression. We talked about the rise of Black girls in the juvenile justice system and the trauma that Black mothers are experiencing every time their children leave the door or leave the home and not wondering if they're gonna come back. It was a powerful event, but it was also very intentional. as we also explored some solutions to much of, I think, what Black women and girls were experiencing and continue to experience today.
Thank you for bringing that voice forward. That's very powerful. Let's review the first of the 4 research areas that we're going to discuss today. So economics. Economic security is not just a condition for survival, but a lever through which women and girls can thrive. Researchers and community leaders are likely not surprised by what we see in terms of economic and health impacts that often point to inequities across our systems. The research highlights impacts of what we identify as systemic racial injustice across our systems. That includes healthcare access, underlying conditions, job security and wage and benefits, who goes to college and enters the pipeline for jobs that earn a good living, and in effect, who is set up to use the building blocks to wealth creation that include home ownership and the like. From your research, Dr. Ewig, why are we seeing women and Black, Indigenous, people of color, women in particular, experiencing more severe impacts right now?
Well, I can give you a little bit of a preview of some of the research that I've been leading over the summer by the center, separate from this status report, that is on the impact of COVID-19 on Minnesota workers. And there we can really see a disproportionate impact and a distinct impact along gender as well as race and ethnic lines. When we think about women, what we've discovered is there's been really a dual vulnerability across the board. We see more unemployment claims by women in the state. When we then look by race and ethnicity, there's a greater number proportionally to their population among women of color, Black and Indigenous women and women of color. But for those women that are working, they are more likely to be in the high risk essential workforce. So either they're facing risk on the job, risk of contagion with the COVID-19 virus, or they are facing layoffs. And so we're seeing some, and in both of these areas of vulnerability, we're seeing a disproportionate number of women of color.
Mm-hmm. We see in this report that women's economic security intersects with every other issue in a woman's life. Isn't it true that occupational clustering is a real part of that?
It is. So, and we can connect this right to that dual vulnerability that I was just speaking to under COVID-19. So the graph here is taken from our status report this year, the 2020 report, and it shows 2-year certificates in a range of different kinds of occupational categories. And you can see with the purple line and the graphs on the right-hand side in particular being more women that are in the very far right of your screen, you see more in the health professions and related programs, followed by personal and culinary services, actually just to the left of that. So both at 86% women pursuing these degrees. This pretty much translates into the workforce where we see high concentrations of women in these occupational categories. And when we think about the impact of COVID, this is exactly what we saw in terms of that dual vulnerability that I just mentioned. So of course, things like beauty shops and restaurants closed, and those are the women that we see principally being laid off, while health professions and related programs make up part of the most critical part of our essential workforce in the time of this virus. Meanwhile, though men tend to be concentrated in construction trades, mechanics, etc. Those areas were also considered essential work, but they were low risk and are low risk. So this real duality we can see beginning with choices that are made in terms of what occupations to pursue. And this also leads into the gender wage gap.
Yeah, absolutely. You know, one of the things that we heard through some of our grantee partners, I'm thinking specifically about one that is the Hmong American Partnership, that we fund through our Girls Best program. What they're doing with young Hmong girls and women is mentoring and providing internship opportunities and stipends, financial literacy training, and career exploration, precisely to help level the playing field for this particular group. So if we're gonna really level the playing field, we have to take every community and assess what their particular barriers are and address them directly. So nationally, we recognize Equal Pay Day, which was on March 31st this year, and that typically lines up most with white women's earnings. At the foundation, we also recognize the Equal Pay Day for each of the communities represented here. Native American Women's Equal Pay Day, for instance, isn't until later in September, the 23rd. And we argue in our work that we need to center the earnings of Latina and Native women on this chart, who earn 54 cents on the dollar. Somali women earn even less and must work twice the amount of time, 2 years, to earn what the average white man makes in a year. So we center their experience in fight for equal pay as our finish line. And unfortunately, this statistic is not getting any better. The gender wage gap in Minnesota hasn't narrowed over the past year. What would you say about that, Dr. Ewig?
Well, I would say that in this graph that you see here, it's a good example of how when we do our research for the status report, we're really focused on the specifics of Minnesota. So we have here the typical race and ethnic categories that we usually pay attention to nationally, but we also pull out the largest ethnic groups in the state. So Asian, Indian, Hmong, and we separate out African American and Somali. And it's important to do that because we often have ideas about particular groups being better off than others. For example, the idea of Asian Americans being the model minority. But when we break up the data and then see that Hmong women are among the lowest paid, 55 cents on the white male dollar, we really begin to understand our local reality a lot better. So if we take this wage gap, a lot of things contribute to it. On the one hand, there's the occupational clustering that we mentioned before. There's other factors that go in. People might say, well, this may have to do with education. It actually doesn't. We know that over time and with greater education, the gap actually expands between men and women. And over a lifetime, women in Minnesota are estimated to lose more than $400,000 in lifetime earnings due to the gender wage gap.
Thank you for sharing that. Let's look at the next slide. Talk to us a little bit about the cost of childcare outpacing income.
Yeah, so, you know, one of the big reasons for the gender wage gap over the life course is because women will take time out of the labor force in order to take care of children. And it may make complete sense in a family in which you have two breadwinners for the one that earns a lower wage to take time out of the workforce or to work part-time when the cost of childcare may actually be more than that salary, that second salary that they may be making. For other parents, it may not be an option. You may be the single breadwinner and you're not able to take that time out of the workforce. And so one of the major issues that we have here in Minnesota is the cost of childcare and how here we've broken down the median income for these major race and ethnic groups. We didn't have enough granularity in the data to break down the immigrant groups that I mentioned before. However, we see that for the median income of both Latinos and Native Americans, child care for single mothers in those categories exceeds 100% of that median income for those groups. So a large portion of families' income, and especially that of single mother income, is going to childcare. And that is an economic burden on Minnesota working moms and dads.
Yes. This is also really brings to light also the need to look at how much these caregivers are earning in terms of the cost and the impact for that. So we definitely have to figure that out. On the next slide, I'd love to talk about the wealth gap. Last year, we saw in our Status of Older Women report that an accumulation of disinvestment in communities results in a compounding of all the various disparities over time. Wealth is more unstable for non-white groups. Wealth overall has been generally stable for white communities over generations across our state, but the same can't be said for communities of color. And so this really points to the systemic causes leading to the lack of intergenerational mobility. Wealth provides advantages like educational opportunities, homeownership in safe neighborhoods, and a financial safety net. These are just some of the components. Dr. Lewis, can you walk us through how some of this is felt in the lives of people you've spoken with?
So I want to kind of reiterate these different positions I hold and these reports I've contributed to give you context. So I'm a senior researcher at the Center for Urban and Regional Affairs. And in my capacity there, last year I completed a 2-year study on evictions called The Illusion of Choice. I also am the founder and CEO of Research in Action. And in that capacity, I wrote Minnesota's first report on Black women's economics, which came out in 2015. And in that particular report, national data tells us that Black women retire with an average amount of $100 of wealth, which is compounded by the fact that they are also most likely leading single-headed households with children. But on the ground, like, what does this actually look like? And I feel like with the study that I conducted through my position at Cura at the university, we were able to really get to the heart of the stories of what that looks like for families. So, the ability to build and generate wealth is directly connected to the illusion that we all have access to the same choices, which is just not true. So of the 68 tenants that I interviewed for the Illusion of Choice project, 57% said that the place in which they were evicted in was not their first choice of housing, and 37 said it was their only choice of housing. And I'm going to share some quotes or stories with you to contextualize. So the first interviewee was a Black female, 48 years old, and she said, "Because I was having a hard time finding affordable housing, me and my daughters have been searching for 2 months. It was getting cold out. So I knew I had to get in somewhere. So the first thing that came to me that looked presentable, I accepted. You get put into desperate situations where you have to take a place even if you don't know anything about it." Another woman who's 38 years old stated, "But I agreed to it because I didn't want my kids to be homeless. And I did not know that. Okay, 2 weeks I'll have this, 2 weeks I'll have that. But I was trying to prolong the situation because I didn't want to be homeless." Once you find a roof over your head, that's the first step, right? And in whatever condition or whatever context. But then you're living in a constant state of crisis decision-making. 68% of those we interviewed said they often had to decide between paying rent or fulfilling another financial obligation. A participant stated, "Most of the months living there, for the whole duration I was there, it was always, how am I going to rob Peter to pay Paul? I have $1,300 and $1,000 of it goes to my rent. So what am I going to do with the other $350 between transportation, food, clothing that I need for us, household supplies, personal care, anything like that?" It was just very scarce. Almost 100% of the folks we interviewed said that their inability to maintain housing was connected to factors completely unrelated to housing itself. What does that sound like? A participant who was a 30-year-old Black female stated, "And then basically I lost my job because I and the people I was driving with to clean houses. Well, first our car broke down. We bought a car in February, broke down a month later. I was riding with people. I was riding with my sister. She worked with me. And then after that, I was riding with my friends. And both of them are the same people that left and skipped out on rent. And I didn't have a ride to work anymore. So I had to stop working." Another female, 53 years old, stated, "And the reason I didn't pay rent in July is because of my boyfriend. I'm coming from a battered situation. My boyfriend always beat me up, jumping on me, taking my money because he wants to do other things with the money. But I say, pay the rent and different stuff. So he stole that month's rent, the July rent. But I told the lady I'd pay up next month. and then I'll pay my other month. I can do that. You know what I'm saying? I say that would not be a problem, no issue, nothing like that. You have generations of women forced in the low-wage sector living in geographies where exploitative housing practices are rampant, and networks of poverty often make it challenging to exercise true agency when many other institutions and owners wield more power over fulfilling their direct human needs.
Yeah, thank you. Let's talk a little bit about some actions that could be taken. Christina, what are your thoughts?
I guess I would say when we think about a lot of the components that are leading just to the economic inequities, of course, you just heard from what Brittany said. There's a lot of things that interconnect here. It's not other issues that we're going to talk about in a little while, safety, health, impact the economic areas. But if we think just about the economic areas, subsidized high quality childcare would be one step of beginning to even the playing field for working women in Minnesota who have children. Another is the value we place on different kinds of work. Minnesota does have some pretty strong pay equity legislation, but it applies to the government and not to the private sector. But valuing work that we consider to be feminine, which then ends up being lower paid, and bringing that up in terms of the value that we place upon it. Another action item that I would say is, and what we're certainly seeing in the research we're doing, we've been doing this summer on gender and COVID, and we'll be releasing that report in the next few weeks, but the importance of unions. So those folks that are working in unionized workplaces have better social supports because their unions have advocated for those. So those would be some things that I would point to in this section.
Yes, thank you. One of the investments that the Women's Foundation has made is in a Young Women's Initiative, which is a statewide initiative, and working with young women to get them into non-traditional fields, identifying high-wage job opportunities for them, investing in them now, not just for their career pathways and educational pathways, but to help them identify solutions to the problems they see in their community. Giving them that sense of agency is one of the things that we have done as a foundation. The other is, through our funding, we have made grants to, for instance, a high school program in the Iron Range where through M-State in Moorhead, young women are being enrolled in non-traditional fields. And so that is, in fact, a focus on STEM and non-traditional fields, I think, is going to be a real game changer. Another group that we fund, as an example, would be McGizzy Communications, which is here in Minneapolis on Lake Street. And they're advancing education, leadership, and youth development for American Indians in the community through their media and green jobs pathways programs. And so those are just a couple of solutions that I would point to. So let's go on to health and talk about how that is another critical lever. Dr. Ewood?
Sure. I think in the current context, the importance of health and existing disparities in health has become more clear to all of us. We have seen a higher death rate to COVID-19 among those that have pre-existing kinds of conditions. And it is more people of color that are succumbing to COVID-19, to death from COVID-19. And it's because of a lot of the background health issues caused by historical trauma, the stress of the economic situation that we've just covered, as well as access to health care. And racism within the healthcare system itself, I would add. So the status report that we are launching today actually covers a lot of these pre-existing disparities that then, when we began to see the COVID-19 numbers come out in the media, did not come as a surprise to me once we knew that linkage between pre-existing conditions. If we look in Minnesota, for example, Native Americans, even though Minnesotans and in general, and women in Minnesota in general, have a lower mortality rate from heart disease than women in other states, Native Americans have a 50% higher mortality due to heart disease than white Minnesotans. When we look at women of color, so Black women, women of color, Native American women, they're at a greater risk of dying from certain kinds of cancer than white women. And we also see higher rates of stroke, especially for women in general compared to men, with much higher rates for African Americans and Asians. So this kind of tells us that we've have some really important health disparities that cross gender and race simultaneously, and then help us to understand why this crisis now is so dramatic, especially in communities of color.
Right. Now, Dr. Brady, you might, or Dr. Lewis, you might want to add, but I'll just say that the other thing that we've noticed in this particular moment in time is that mental health continues to be a critical issue and a growing issue in our community related to the trauma that people are experiencing, and not just the trauma of our racial uprising here in the community, but also related to just the economics and the poverty that people have been living in. Dr. Lewis, anything you'd want to add here before we move on?
Yes, I agree with you 100%, Gloria. Like my colleague, Dr. Joy Lewis said, with post-traumatic stress, unfortunately, there's no post. And I think that we need to kind of acknowledge and realize that. In the Illusion of Choice report that I made mention of prior, 40% of the folks we interviewed were actually receiving some kind of mental health support prior to being evicted. 10% stated they should have sought it out afterwards. I think this matters a great deal. I note to folks all the time, as someone who is an urban housing economic development scholar, it's never about the house.
Mm-hmm.
It never really was. I also think when I reflect back on the Minnesota Trust Black Women and Girl Town Hall work and the health and wellness panel specifically, in addition to talking about postpartum depression, overdiagnosis or misdiagnosis of Black children within our education system, and or the lack of financial support for what we consider to be non-traditional healers, i.e. folks that do not have a degree, and how much that work is needed. It's compounded because you're also looking for culturally relevant services and support that you can relate and connect to. So I think this question of mental health resources and also acknowledgement of mental health, the need to even discuss it, dehumanize the question around mental health, is still is a huge issue across communities of color and for women of color and their families specifically.
Through our grantee partners at the Women's Foundation, that is an area of investment for us, and looking at women and girls on a holistic level and investing in programs that support them through a whole variety of, building healthy relationships, being physically active, understanding the implications of health for them. So another area that I want to move to is safety. And overall, we know that violence is a reality for too many women and children in Minnesota. And in this time of COVID, we've heard that home, which is where we're all supposed to be sheltered in order to stay healthy, isn't always a safe place. Dr. Ewood, what are you seeing?
The center is supporting some research being conducted in the School of Public Health and School of Social Work here at the U by Ruby Nguyen and Lynette Renner. And they're still sorting through the data. They're using a number of different sources of data to estimate what kind of impact we've seen of domestic violence during COVID-19. So quarantine in particular could have created greater tensions within households, but it also means that it's possible that you would see fewer calls because people would be more concerned about making a call when they're in a more enclosed environment due to the quarantine. So they're still sorting through that data to really get a good handle on it within the Minnesota context. But we do know pre and post COVID, there has been a long-term issue in terms of more demand for services related to domestic violence than we actually have the services to handle in the state.
Mm-hmm. And at this particular time, as we were talking with some of our grantee partners impacted by COVID, they really were concerned about children having to stay home, and often the teachers and social workers in schools being the ones identifying any vulnerability. They are not in contact, had not been in contact with students, and so that was a real concern. And then also through some of our grantee partners serving the LGBTQ youth, their concern was that many of them would be having to move home, which for many is not necessarily a safe place. And so we don't know what the impact of that will be, and want to continue to support our grantee partners who are looking at offering safe housing away from abusers, providing financial assistance and basic needs, and connecting victim survivors with culturally appropriate, linguistically appropriate services.
Yeah, I think that the focus on LGBTQ youth and homelessness is important. That extra, or they have often added concerns within the household, as you mentioned, Gloria, that then leads to homelessness. So we do have 22% of Minnesota young people that experience homeless identify as LGBTQ+. That's data that we get from the Wilder Foundation in a regular survey of homeless youth, homelessness that they do. And there was a question that we had in the question and answer here. What about other gender identities? And so this is one way, to the extent that we can, we bring in whatever data that we can find into the report about LGBTQ plus identified individuals. For example, in the wage gap, we see lesbian households, same-sex women households, women-headed households having a lower overall household income. You can just think about that gender wage gap being brought down by two lower wage gap, lower earners in the household. But we can't always get this data, especially, for example, for trans individuals, in the statistical kind of data. That's where we really need to go to some more qualitative sources to really understand experiences of a broader range of Minnesotans. But this is one piece of data that we are able to provide.
Thank you. On our next slide, we really wanted to dig a little deeper in this year's report into the realities of violence Native communities are facing with gender-based violence and suicide. What can you tell us here, Dr. Ewig?
This was in addition to this year's report, and I was really pleased to be able to add it. The Sovereign Bodies Institute, which is a nonprofit that seeks to collect data across the country, was kind enough to work with us in providing more data, especially on missing and murdered Indigenous women. Their data shows that there are 119 cases of missing and murdered Indigenous women and girls in Minnesota since the year 1990, but 90% of these have been since the year 2000 or later. I'd also like to bring into this a mention that links up with Dr. Lewis's point about the importance of mental health. We also find in the health section of this report an extremely high rate of suicide among Native girls in 9th, 10th, and 11th grade, almost 25% who have attempted suicide, which far outpaces any other group in those grades. So attention to violence and also the health and mental well-being of Native women is a really key and a key component of this report, but one that really demands a call to action.
Mm-hmm. And sometimes the first step is really just shedding light on the problem to bring it out of the shadows. And I know that through our policy advocacy work, the foundation did support the creation of the Native-led Missing and Murdered Indigenous Women's Task Force happening at the state level. And and investing in community-led programs and initiatives for community healing and wellness. We are really grateful to the Native communities for really bringing this to light across our state so that we can tackle the issue. Dr. Lewis, any other opportunities that you would identify here, actions that we could take as individuals or institutionally?
You know, something that kind of popped in my mind just from many of the interviews that I've done, that, you know, I would love to learn more about what is or isn't happening. You know, a number of the folks I interviewed shared stories of domestic violence, but then also would share their treatment in local domestic violence shelters. You know, these are women of color saying that they do not either feel welcome or supported in what appear to be predominantly white spaces. And what does that lead to? I did a number of interviews in this project in people's actual cars, because that is where they are choosing to live as an act of resistance for multiple reasons. One, because in Hennepin County in particular, there's a self-pay policy in our shelters, which requires folks to pay to stay. I'm actually working with the county and People Serving People right now to reimagine that policy as a result of this research. But also, you have women going either back to their abusers and or unsafe housing contexts where they're couch hopping and placing themselves and their children in, you know, unsafe contexts because they don't feel safe or comfortable being open and honest in some of these shelter spaces. I would be more interested in exploring what that looks like. And a part of me doesn't believe it's necessarily a practice or policy change, it's about culture change. Let's just be really honest. When I do my engaged research, we believe in mixed method research, but I'd also argue in community-based solution making. Every recommendation that came out of our reports came from actual participants themselves. I was not aware that self-pay was a policy in Hennepin County prior to, until sitting in folks' cars and I'd have someone tell me, after I get off work, I'm gonna go pick up my children and we're gonna get back in this car. You know, and one of the pieces I feel like we haven't explored on our end enough is what is happening in the very few domestic violence shelters that are available in this area, and how they're representing different women, and if it's being addressed and in what way.
Your story really points to what we believe, which is to center the communities most impacted in the solutions and investing in their wisdom and leadership. Because we really do need to hear what the experience is, what are the cultural barriers that women and girls are experiencing when they're in shelters. One of the programs that we invest in that I think does a very wonderful job with that is Casa de Esperanza, as an example, where they are working, you know, with and it is led by a group of Latinas who are very in tune to the needs and the culture of the women who are not only being served through the shelter, but also the innovation with CASA is that they are working with boys as well as girls to look at how they are being socialized in gender norms. And so definitely something that we can continue to look at. Let's talk now about leadership. And when we look in the area of leadership in this report, this is actually an area where we do see some progress and definite areas where we can improve, especially as we think about how institutions help move the needle and create a stronger workforce for the future. We've all seen remarkable leadership on the front lines here in Minneapolis and at the center of the movement in climate change and in racial justice and in community policing. And certainly this year, with the first Black Asian woman being nominated for vice president and having the highest ranking Native American woman elected to executive office in the United States, we've got Peggy Flanagan, our lieutenant governor, who is an enthusiastic co-chair in this young women's initiative that I was talking about. So we have some real progress that we've seen building on the 2018 midterm elections, where we saw Black, Indigenous, and women of color running for elected elected office, some for the first time and winning. Yet what does the research tell us, Dr. Ewing?
Well, the last election, the November 18th election, was great, right? We saw a lot of firsts. We saw a lot more, we have the highest number of women of color, in fact, people of color in the Congress, in the state legislature. And so this is good news. What this graphic shows us is that there's still quite a way to go. Here you have different colors for different groups, from Native American women, Latina, Hmong, and African American women in the Minnesota legislature. This is based upon data from the legislature itself, and they break out Hmong as a category. But if we know that 20% of the state is Black, Indigenous, or people of color, about 10% are then women that are Black, Indigenous, or people of color, and we're hitting almost 6%. So we're not there yet in terms of actual proportionality of representation. And in fact, if we look at just women in general, not women of color in particular, we've seen at the level of the state and representation in the state legislature, that number actually dropped in 2018 in terms of the overall number of women legislators, even though we had the good news of more women of color. And this is an important area, right, for if we want to see more women in national office, the state is the training ground for moving up to those other positions. So that's worrying that we've seen a decline.
What do we see about corporate leadership?
Corporate leadership, you can see here a very slow trend of increase. And the problem here is that at the current rate, it will take 52 years to reach gender parity of women in executive positions and on boards of directors of major corporations. So we're hitting at about 21% in 2018 in terms of executives that are women. Where the numbers of women of color in these positions are too small. We tried to work with those to really give you any kind of meaningful data, meaning it kind of goes up and down like a seesaw without a clear trend. But overall, I think the take-home message here is in corporate America, there's also a lot more to be done, and we need to speed up this the grade and incline that we see in this graph.
One of the things that, thank you for that. One of the things that we've seen here at the foundation is we have been able to enlist corporate leadership through our Young Women's Initiative to partner on an executive council with the young women, creating pathways for opportunities, for internships and mentoring, and really building their understanding as corporate leaders of how they need to prepare themselves for the voices of young women and a diversity of them to be entering leadership positions. So in terms of solutions, I think it really is about actions that we could take, like through YWI, are building that pipeline, as you mentioned, Dr. Lewis, focusing on creating culture change within the existing institutions, diversifying the fields and opportunities, pathways for women to not be overrepresented in those low-wage, undervalued fields. Other things that you might offer, Dr. Lewis?
I mean, the third thing that popped in my mind is, when I think about leadership and progress, I think about kind of economic leadership.
Mm-hmm.
And in the 2015 report that I wrote, we talked about this kind of poster child effect of Black women outpacing their peers, growing businesses, but then they don't retain or expand those businesses at all. I use the frame poster child because they were on the cover of this American Express Open report, which is aiming to presumably praise Black women for their ability to think differently. Well, let's just be honest. They're thinking differently because they have to.
Mm-hmm.
And also they're starting businesses with like 2 or 3 other jobs. right? So I really was frustrated by some of the narrative framing around that. In the report, we really pulled back the onion. It is much deeper than that. And instead of paying attention to why Black women are starting so many businesses and actually having the state contribute to helping to break generational poverty by ensuring that Black women get more access to procurement contracts at the state level or the county level, because if you look at that data, you'll see that that's rarely happening. But we feel comfortable putting a Black face on something that makes us feel good. I feel like pulling back the onion, which I appreciate about this report, how we disaggregate data, was one of the biggest recommendations we made in that 2015 report. You know, the report starts by highlighting that at the height of the kind of unemployment crisis, I think it was in 2010 we looked at, well, actually, you know, Black women compared to Black men were unemployed even more. But if you have this unemployment debate, it has this binary gendered conversation between white and Black and men. And that just wasn't true. So I think in form of leadership, I think about Black economic leadership, because I'd argue that that has been the bedrock of our community. We once had thriving businesses, business districts in this country. Leadership, I'd argue, had been with cultivating businesses, supporting your community through that framework, and that has been decimated. I'm really happy to see the number of Black women running and winning, but I'm also paying close attention to what our daily needs are and what leadership looks like in community every day, where some of the work that policymakers make might never trickle down to us or touch us, or we might never really directly feel it, but that local merchant, that local business owner that gives you that opportunity, that has a way, I think, to build leadership of young people in ways that other forms of policy change might not trickle down to us in the same direct impact. So I'd love for us to think more deeply about supporting women of color businesses and thinking more about procurement and state contracts.
Thank you. So what can we do at the Women's Foundation? One of the things that we believe is that equity in design results in equity in outcomes. And we know that we can make changes on individual levels. And one of the ways to do that is through our own spheres of influence, if you will. We can speak up when we don't see representation in the rooms where decisions are being made. We can speak up when we hear talk that harms or minimizes women and girls or people of different races, abilities, and identities. We can demand that we listen to folks who are representing the varied identities in solutions affecting their communities. You know, at the institutional level, we've covered a lot of what might be done. I know that we're running on short time here, so I want to thank you, Dr. Ewig. Thank you, Dr. Lewis, for sharing your insights with us. I want to thank all of you for joining us. We tried to embed in some of our responses to your questions, but hopefully this will be the beginning of a conversation. We will continue to share this data. We will continue to listen around the state to make sure that women and communities who are identifying problems can also be part of shaping the solution. So just want to in close say thank you both. Any final words, Dr. Ewig, Dr. Lewis?
I guess I would say as we move forward and think about a brighter future, this particular context is an urgent context. We've called this webinar The Urgency of Now. It's urgent in terms of the impact of the COVID-19 virus. It's urgent in terms of the racial disparities that have come out in terms of policing and COVID in our Minnesota context. And we need to think about how do we walk out of this with opportunity by creating an infrastructure that allows everyone to succeed rather than dwelling in the difficulties that we all do face, which we have to deal with, but let's think about it collectively as an opportunity to make change for the better.
Thank you. Dr. Lewis?
Yeah, I would love to thank you all for inviting me to join in this conversation. And I want to quote Dr. Cornel West really quickly. he made a statement that I love so much. He says, we don't need lukewarm folks. We don't need summer soldiers. We need all season love warriors. I absolutely love that. Everything about what we need right now, we're naming the politics of white supremacy openly because it's in our face and we can't ignore it. But when Dr. Cornel West makes that statement, in short, he's saying we have to go beyond this kind of fake woke politics like social media activism to think about strategic solutions that address systemic inequities, a vision for equity that looks for solutions that work collaboratively with community. And we have to stop doing things to community and do it with them. And for the first time, there are a lot of folks kind of engaging in this work and questioning for the first time. And we're gonna make mistakes along the way. But as Christina mentioned, the time is now. We have an opportunity to do it better and show up in our more authentic, true selves if we give each other that grace. So thank you so much for inviting me here to be a part of the conversation.
Thank you. We will get through this together. And thank you all, our virtual community. Have a wonderful rest of the day. Bye-bye.